now I have control to do that. And now we can start recording.
Okay, great.
Very good. All right. Ready to go, Doctor?
Yeah, I'm ready.
All right, very good. Coming at you in 3, 2. As we talk about the Black Lives Matters movement in class, we look at not only what's happening in the media and in government, we want to look outside into businesses, institutions. And one of the areas of interest that I have right now for my class is in the medical profession, racism and how it's been dealt with over time. And today we have a fantastic example of a guest who's stepping forward because he says he's been troubled by some of the things he saw early on in his medical training. Please welcome Dr. Richard Henke. Doctor, good morning.
Good morning. Glad to be here.
How are you doing today?
I'm doing very well. Professor, how are you?
I'm doing very well, and I'm thrilled that we finally get to see each other. We talked a little bit on the phone. Tell everybody in the class, what's your background? What have you done in medicine?
Well, I'm an emergency physician. I graduated from my internship in San Francisco in '74, but from my medical school in Texas in '73. We moved from the Northeast to Texas when I was a 9-year-old kid. I had experienced zero racism to that point, and I'd hardly ever seen any black people, frankly. And I landed right in the middle of it in Ku Klux Klan territory when my dad got transferred down to Port Arthur, Texas. So to make a very long story a lot shorter, I was the in lover in high school. I won't say that word, of course. I was taught as a kid that racial prejudice was wrong. My mom said the Bible says we love one another. It doesn't say we love one another if they're white. That was her explanation as to why we didn't hate the Negroes like everybody else down there. I went to Texas medical school. I had no money. I had to go to a state school because I put myself through medical school working at night. I couldn't afford, obviously, to go out of state. And in the last 2 years of my medical school, I saw such horrible things, cruel things done to people, unnecessary surgeries, things that would curl your toenails. I could not stand it. I just had to get out of Texas. And as soon as I graduated, I bolted for the West Coast like I was on fire.
All right, I understand. And that's okay. We want to hear about what you went through as these experiences unfolded in Texas. And I will tell the class, some of the details you're about to provide are pretty graphic, and some of them are very hurtful to listen to. But I think it's important to establish that back in the early days of your career, racism was a problem, and you were working at a hospital known as Parkland Hospital in Dallas. Is that correct?
Correct. That was the main hospital that we medical students rotated out. There were others, but this is where the experiences took place, which I'm going to describe.
All right, very good. And my students should know from school that Parkland Hospital is the hospital where President John F. Kennedy died after the assassination in 1963. So you were there in what year? 1972, I think you told me?
1969 through 1973.
Okay.
And at that point in time, the first 2 years of medical school were basically didactic. You're studying a book, you're in the lab, you're dissecting a cadaver, you're doing that kind of stuff. The last 2 years are clinical. You start taking care of real live human beings where their life and death might actually depend on your decisions. And that's where I saw the terrible racism. I mean, I've got 3 main stories. The first one is not gross, but the second 2 are kind of graphic.
All right, let's jump into the first story. Exactly what happened?
Well, I was a student on the surgical service. The way the surgical service, like many teaching services, were arranged is you had 5 medical students on a team with 1 or 2 interns, a resident, and then the chief resident would supervise that team and the other 3 or 4 teams that were in that department's rotation. So we had 4 teams in the surgical department, each composed of 5 medical students and all the rest. So one of my patients was a laborer. The guy was a 28-year-old black guy. He was not educated, but he was not a stupid man by any means. He had a bleeding ulcer. He wasn't a heavy drinker or anything. It's important to note that the treatment for ulcers back then was the same as it is now. Uncontrolled bleeding or uncontrolled pain. The treatment obviously is far more advanced. Back then, all we had was antacids and a dietary regimen and the like. We would customarily admit a patient several days before the surgery because the hospital bed only cost $30 or $40 and allowed us to do all their lab tests and get their workup done. As a medical student, I had to do a rectal exam on my patient every day and test his stool for occult blood. On the fourth hospital day, and I spent a lot of time with this guy, I cared about what I did. The patient's occult blood test was negative. His pain was gone. I was elated. That day on rounds, I announced to the team, my patient's cured. He doesn't need his ulcer surgery. He can go home. I was just elated. Well, the chief surgical resident, who was a really big fellow, after all the discussion, at the end of rounds, he walked up to me and he draped his big arm over my shoulders and said, listen here, boy. We get a lot of appies and gallbladders here, boy, but we don't get many stomachs. We need that stomach. You hear me? So you keep your mouth shut, you hear? And that's what he said. You keep your mouth shut, you hear?
What did he mean he needed this type of patient? What was he planning to do?
On graduation, surgeons like to have a caseload they can show. They don't want to show that they can just take care of common stuff like appendicitis or gallbladder disease. They want to show they can do rare stuff or less common stuff like stomach surgery and the like. They wanted the case for their case count. There was no higher motive than that. They wanted us to say, well, I've done X amount of stomachs. They wanted practice. My patient was going to be practiced on.
So they were going to be used as guinea pigs.
Well, I mean, a guinea pig's experimental. This is a well thought out surgery. This just wasn't appropriate for this patient.
And
this
what
surgery
happened?
was done hundreds of thousands of times.
What happened with this individual?
I went home and started calling my fellow students, the ones that I knew weren't racist. And I said, what's going on here? Have you seen this happen before? And more than one of my fellow students said, well, yeah, if the patient's black, they'll just do the surgery, they need the case count. So I understood very well at that point what was going on. So I waited. Patient's surgery was scheduled for the next day. I waited until 10 p.m. when I knew all the muckety-mucks had left the hospital, no more residents, etc. And I went to that patient's bed and I sat and had a chat with him. I said, you don't need your surgery. They want to cut out part of your stomach tomorrow. I've taught you how to control your ulcer. You need to go home and follow my advice. And my advice to you is get the hell out of here as soon as you can. Don't let them find you here in the morning, or you're going to get surgery you don't need. And furthermore, if you tell anyone I told you this, I'll call you a liar to your face because I need this job. I was a poor kid. I needed the job. I needed my degree. And I could have gotten booted. Patient understood. The next day at bed check, he was gone and nobody knew who or why he was involved. So I saved that one guy. Now I'll tell you about the one I couldn't save.
Well, first, before you do, you felt relief that you did the right thing by helping a human being. But if you had reported this, or if they had found out what you had said to him, you might have been kicked out of the service, right?
I might have been kicked out of medical school altogether. I'm being a disruptor, and there's no way I could out-argue the chief resident. He would say this stupid medical student doesn't know what he's talking about. This guy needs a surgery, and this guy is just a shit disturber for no reason.
Mm-hmm. Did you ever hear any more from that patient, as far as you know?
No, he didn't really have a good way of contacting me. I had no expectation of hearing from him. I just wanted to know that he was free to live his own life and not get cut on needlessly.
Okay.
So I was very happy that he was gone.
Well, now you said there's two other stories that are a little more graphic. So viewer discretion is advised, as we say in television. But if you can, tell us one of those two graphic stories.
Well, I'll tell you about the patient who had a major surgery that may not have been warranted. 33-year-old black female admitted to the surgical service, but she wasn't on my team. So I examined her with the other 20 medical students, but I wasn't her primary caregiver. So I had very little leverage. Okay, this woman was in perfect health except for anal bleeding. Maybe she wiped too much with the toilet paper, who knows? I examined the anus of this woman along with a whole bunch of other medical students, and I found absolutely nothing wrong with it. No bleeding, no swelling, not even an hemorrhoid. Her admitting diagnosis was cancer of the anus. And what was planned was an abdominoperineal resection. And I had to be present in the surgical suite when that was done. What they did was they took out all of her colon from the small intestine down. They took out all of her female organs except for the vagina. They took out all the tissue around the anus, leaving with her big gaping hole. For a diagnosis of cancer, the anus wasn't even big enough to see with the visible eye or feel with your finger on digital examination. See, I never saw a path report. I can't prove that this was inappropriate surgery. I just strongly suspect it because clinically this woman was normal. And the hell of it is, she was perfectly healthy. No diabetes, wasn't even overweight, nothing. And it haunts me that she may be alive today at the age of 81, not knowing that she lived, she was gutted like a fish without any clinical indication.
And then this was in Texas, the late 60s, early 70s. And did you report this to anybody? Were you able
72.
to?
No, I didn't want to get thrown out of medical school. No, you couldn't do that. You couldn't do that. Not in those days.
And even if you did, the prevailing attitude at the time was what? About black
Well,
people.
I mean, they black people there were a substrate. They were there to be used, not just to be cared for. And this was, and see, it differed. The surgical services were the worst. The internal medicine services and psychiatry, of course, were a lot more gentle with people and a lot more humanistic back then. But the OBGYN service was even worse than most surgical services. And that's where I saw people examined in a way that amounted to sexual assault.
Wow. So
and that's the third story, and I don't have to get into details if we don't want to.
No, details is okay, but I want to follow up on the second story.
Sure.
So the woman never came back to the hospital. There was never any follow-up from her side of it.
I don't know. See, I was only peripherally involved. I was not her main caregiver. I had no direct responsibility in the case, but I did have to be present on her rechecks on rounds for the next 3 days, at which time the surgical resident, after being commanded to do so by the chief resident, would put his gloved hand and stick it up with no sedation or anesthesia into the surgical wound and move it around vigorously while the patient screamed in absolute agony in case there was any pus in there. This was just abject cruelty for no damn reason.
Wow.
I think they enjoyed, some of those suckers enjoyed seeing people suffer, because a lot of places in the South, you were not just taught to discriminate against Black people, you were taught to view them with contempt.
So if a white woman or man, or a woman in this case, had come in, would they have treated a white patient like this?
She might not have even had the surgery. I doubt it was indicated. No, they would not have. They would not have, and they did have white patients there.
Mm-hmm. Describe, if you can, at this point, the administration, your supervisors, the way they talked about race. Give us a sense of what was the energy in your workplace.
It wasn't talked about, really. It wasn't talked about. But I will say that, Dr. Pritchard, who was head of the OBGYN department, was a humane, gentle, and non-racist individual. He was an older fella. And after my patient in the OBGYN department was sexually brutalized by the resident, I went and talked to Dr. Pritchard, and he basically just rolled his eyes and shrugged his shoulders and said, "It's a damn shame what goes on here. I just had a resident graduate," and he says, "I'm going to go to Arlington instead of my practice. It's where all the rich white people lived at the time. I'm going to send all the in patients to you." And he said, "This is the environment we're dealing with, that we have these horrible attitudes." And he seemed totally impotent to do anything about it, because his attitude was not the common one at the time. He was a minority. The racists were basically in control, and I got a newsletter from my medical school a couple of weeks ago. It showed all these smiling, multi-ethnic, multicolored students with white coats holding Black Lives Matter sign out, and white coats for Black Lives. I mean, things are so different there. They have no idea, I'm sure, what went on, but the people that participated in this and were victimized by this, a lot of them are still there, still alive.
Living in that community.
Or wherever.
Right. And you said there's a third example that you wanted to bring up?
I'll try not to be too graphic, but in the OBGYN department, it's a teaching institution, and back then it was considered important to do pelvic examinations on women, where one has to do the internal examination with the gloved fingers and all that. And it was a rule that any woman I guess it was an age limit, maybe 9 or 10, I don't know, would have to have a pelvic exam if she came in with pain in the lower abdomen, where the pelvic organs live. Okay, and this 19-year-old virgin only had a bladder infection, that's all, but I had to do a pelvic examination on her.
Mhm.
Well, you know, most girls or women are very frightened and nervous when that's done for the first time. It's very invasive and intrusive and doesn't feel good. And I coaxed her through it. I was so gentle, explained everything, gave her time to relax, you know, and I had the case all wrapped up. I had a happy patient. She had a bladder infection. I was going to give her antibiotic. Then my resident had to come in and do his recheck. He didn't just review what I told him. He walked up to this poor patient who was still on the table with barely a word of introduction, shoved himself in between her legs. This is a big dude. He could have played linebacker for the Cowboys. Shoved his hand in there. I mean, his whole friggin' hand had disappeared. You know, well, my patient hollered, you know, and felt her organs very roughly, obviously treating her with contempt, and then left the room and left me to clean up the mess. And see, you couldn't report that. I told Dr. Pritchard, you know, he was impotent to do anything about it. That was the reigning paradigm at the time. That's why these things haunted me for years. And then finally, after 15, 20 years out of Texas, I couldn't stand the memories anymore. They wouldn't go away. And I started writing stuff down, which eventually led to you and I meeting.
Mm-hmm.
But this poor woman was a victim of sexual assault. That's what that was.
Now, this was in the South back in the late 60s, early 70s. As far as you know, in the South, has that changed? Or is there an attitude of more modern thinking about humanity in hospitals in the South?
I think there has to be, at least judging by the students I saw parading around in front of my old medical school with white clothes for Black Lives signs. I think that it has to matter. But when I went back to my hometown of Port Arthur for the high school reunion in 2014, and Black people still act downtrodden down there. So I bet these attitudes have ameliorated. They've been reduced, but they still persist to some degree. The first thing I noticed when I moved out to the West Coast, I was so startled by this, and I never imagined this would be my reaction. I noticed that Black people were looking in the eye. They're afraid to in Texas. You look a white person in the eye, well, you're being uppity, right? You're not accepting your inferior status. You could get lynched. They still do that down there sometimes. The younger folks, I don't think, do, but the older people are so used to it, they're afraid to look a white person in the eye. So these attitudes are deeply, deeply entrenched.
And when you saw all the news coverage in the summer of 2020 in Atlanta, Minneapolis, and around the country about issues with police and with the Black community, what were your thoughts?
It just brought back bad memories. And about the third or fourth time I watched George Floyd get killed, I couldn't stand watching it anymore. You know, I've got, you know, friends out here on the West Coast that you know, say white, the all lives matter and blue lives matter, because, you know, I have friends in law enforcement, and what they just don't realize the pervasiveness of this. What I told some of my friends, I said, you folks on the West Coast don't realize how lucky you are that most of our police are educated and civilized. When I was a student down there, a lot of them were KKK. In 1965, the year I started college in Houston, the head of the Houston police force was quoted as saying he thought about half of his cops were KKK members. The common scuttlebutt in town was that they pay so poorly that they have to get these farm boys from East Texas, which is a Klan stronghold. That's where I saw the Burning Cross. And they go hire them on the police force. And what they used to do down there, and it did get in the newspapers, if you were Black or Mexican and you got drunk downtown, they wouldn't just take you to jail. They'd handcuff you and throw you in the ship canal and watch you drown.
Oh, my Lord. We're talking to Dr. Richard
They did
Henke.
that.
Dr. Richard Henke is our guest today, and he's a retired medical doctor, but he's living here in the Bay Area. When you got to California, you saw more diversity of cultures, not just Black people, but Latino, Asian, Middle Eastern, etc. How did that feel for you to be in a totally different demographic community?
I loved it. I loved it. You know, I worked in downtown San Jose for a long, long time. We had virtually every ethnic community on earth down there, and it was fascinating to me. And another thing that I realized, hey, we're in Silicon Valley. We don't have time for this racism crap. Let's all join hands and make money.
Mm-hmm.
You know, I mean, it was a totally different ethic. I mean, I did see some racism, but obviously less in Texas. But no, I loved being in California, and I still love being in California.
And I noticed in our earlier part of our conversation, you were polite and respectful enough to say the N word and not the word they used in the South. Over the many years, say that again, I'm sorry.
I hate that word.
Tell me why.
I told you this part of my story when one of our personal conversations. I was acquainted with racism really abruptly. I was a 9-year-old kid. We just moved to Texas. We went to a department store. I was thirsty. I saw a water fountain. It said colored. And you know, I was not a dumb kid. I thought, well, this must be a marketing ploy. They put some dye in the water. It's going to come out blue or green or something like that. But I'm sure it's not going to hurt me. So I went to get a drink. And all of a sudden, the people in the store start hollering, that little boy's drinking in water. Multiple people start hollering at me. My mom had to come and fetch me away from the water fountain. And I said, what the heck's going on here? I just wanted a drink of water. So I had to get a little lesson in racism then. You know, and during that first year in Texas, I remember asking my mama, because she had to fire one of our babysitters because she was trying to fill my head with all this racist nonsense. I said, Mama, how come we don't hate the Negroes like everybody else down here? And she says, all she said was, when I was young, I read the Bible. It said, love your neighbor. It didn't say love your neighbor if they're white. And that's all she said.
Mm-hmm. And I think that's how most people in California and around the country tend to think of it. But the South had very different attitudes for many decades, if not for more than a century. But I want to get back to the use of that word, because in my diversity and media class, students for the last 10 years have been telling me, no, Bob, you got it all wrong. I know you're African American. I know you're from Chicago, but we've cleaned up that word. We use the N word in music. We don't have to worry about it anymore. That's your generation that still feels the stigma of that. You got to let it go. Now, after George Floyd, I'm going to be asking these students, now what do you think? And doctor, what would you say to them about the N word being used in music or in conversation by groups that are African American or not? What are your thoughts?
Well, I mean, they only get away with it because they're black. You know, obviously white people couldn't do that, but it bothers me tremendously because that word denotes inferiority. That's what it was initially meant to denote. And a tremendous amount of energy is spent in the Deep South convincing white people, no matter how far down on the totem pole they are, that they are superior and that black people are inferior. That word gets used over and over and over again. And to me, those things are all linked in my mind. They did everything possible to keep black people suppressed. And anything they tried to do to better themselves, I mean, the Tulsa Massacre is a horrible example of that, but there are a lot of little examples. Any little thing they could do to keep people down would be done.
And when you raised your family, your children, how did you teach them about race and racism?
Well, I mean, my kids are California kids. You know, I told them stories about what I experienced. They know the stories from my medical school. They know that I've been talking to you, and they know that I was going to try to raise some cane about this. I've tried for years and failed, writing various people, and got no one to pay attention to it. My kids are all backing me up 100%. And, you know, they just think it's stupid. They think it's silly. Why would people make an important decision, such as who you're going to hang out with, who you're going to date, who's going to be your friend, on something as superficial as the color of someone's skin? That doesn't enter into their thinking. Right. I mean, they've passed the Reconstruction, if you know what I mean. The rest of our country failed Reconstruction back around 1870, 1880 when we let it go.
The last question I have for you would be, in 2020, there's a movement around the world to make people aware, to have their eyes open to racism. And to be very clear, the people that in the United States that I think people of color are hoping eyes will be open will be among the white community so that they understand this is not going to easily go away, nor should it. Do you understand that?
Oh, you bet I do. I got a comment or two on that.
Please.
A lot of white folks have a real hang up with the word guilt. They don't want to feel like they're guilty for something they didn't do, something that happened before they were born, whatever. I don't use that word. What I use is words acknowledgement and responsibility. Okay, I don't think any of my ancestors owned slaves. They were poor hillbillies or immigrants. But we as a country, we love this country. We're citizens of this country. We're responsible for how this country conducts itself. As a citizen of the United States, I'm outraged that this stuff went on in the country that I love. I am angry about it. And we as a country need to acknowledge it. I don't have to be guilty of doing anything bad to acknowledge what's going on is grievously offensive to my set of values and to the set of values that I think this country ideally was founded upon. And therefore, I think that everybody is responsible for fixing this. Well, guilt doesn't matter. We're all responsible for fixing this and getting beyond it, like I think my kids have done. We blew Reconstruction a long time ago. This is Reconstruction 2.0. We cannot afford to blow it this time. We can't. We must graduate as a nation to a new beginning, do something like Nelson Mandela did, have a Truth and Reconciliation Commission, some way of having a national discussion to move beyond this impediment as a country. It's a millstone around our neck. It impairs our productivity, our happiness. It impairs everything. I can argue on that from points to sociology, it's capitalism, as to how it's costing us. It's just got to be dealt with.
And young people watching you right now are going to say, well, you saw us in the marches this summer. You saw us marching in Seattle and Portland and Chicago and Philadelphia and all over the country. Young people were taking up the stance and were paying attention to this issue like never before. That must make you feel a little better, give you a chance to sleep a little bit more comfortably, knowing this younger generation gets it. Now they realize it's their responsibility to do something.
It makes me feel a lot better. I feel optimism, but I'm a basically optimistic person. But when I see the attitudes of the young people also, and I notice that a lot of Black commentators, especially older folks, are saying, hey, look, this is not like 68 or whatever. It's not just Black people and a couple of white faces. Most of the people out there are white. They've got our back. So this is going to have a different outcome, should have a different outcome. But one reason I'm interested in adding my little tiny voice to the chorus is we already see some backing off, some of the foot being taken off the accelerator. You know, Minnesota's backing off on legislation they needed to do to clean up the stuff that led to the completely unnecessary death of George Floyd. So, you know, we need not to get extreme, but we need to keep pushing.
Very good. Dr. Richard Henke, I thank you for your honesty, your candor, and sharing your personal stories. I hope you can rest better, knowing that there are journalists in this world who will want to hear your story. And the more you can be honest and straightforward, the more they'll get a sense of what has to change that we've lived through and we're not likely to want to live through again. But as you know, human beings have a tendency to stay focused for a while and then we move on. And that's our biggest fear. So we're going to invite you to come back and talk to the class live and be able to take their questions. Because I'm sure after watching this, they'd love to ask you a few more questions.
I'd be glad to do that. It's been a pleasure being with you this morning.
I want to thank you, Doctor, and we appreciate it.